So do you know, number one, their scope of practice? And do you know, number two, their skills level? Because those things are going to be really important. Assess and know the skills level and the scope of practice for the team member that you're going to be delegating to. So sometimes you're working with an unlicensed professional, or maybe you're working with an LPN, maybe you're working with a fellow RN. If a fellow RN comes over and you're like, hey, can you give that IV push? Rad, right? Like that's something that you can delegate because that team member has the license and the scope of practice to do it. And also, like, understand what's their level of skill. If they're brand new, they may not know how to clean a commode and put it back in the supply room where it belongs. They may not know how to properly like replace your suction or like how to properly discard of a medication bag with a little bit of medication left in it. So do you know, number one, their scope of practice? And do you know, number two, their skills level? Because those things are going to be really important. One of the things that I've discovered working in the ER is when I delegate vital signs, it comes with an expectation to report back to me. Like, I don't need to know if the commode has been put away. Like you don't need to report that back to me, but I do need to know what were that patient's vitals and are there any concerns about those vitals? And does the person I'm delegating repeat vital signs to know when to report an abnormal vital sign, especially in a pediatric ER, because there are so many variations on what's normal depending on the age range. So just make sure that you know who you're delegating to, what their skill level is, and what their scope of practices, because it also puts your patients and your license at risk if you're delegating tasks that are outside of their scope of practice.